What's going down, everyone? How you all doing today? Welcome to Philosophia. My name is Adil. I'm joined here by my co-host.
You right?
And today we have a really interesting topic. It's mesenchymal stem cell treatment. And now, Ira is the so-called expert at
Nah,
this.
not the expert.
At this, so I'm gonna let him take the lead today because it honestly is really, really like groundbreaking. Honestly.
Yeah.
So yeah, go ahead.
So first of all, I was introduced to this topic as well. I was listening to a Joe Rogan podcast where Mel Gibson and a guy called Dr. Neil Reardon was talking about it, and basically they were talking about something called, like Adil mentioned, mesenchymal stem cells, and the way they're used in medicine. And because obviously we're studying pharmacy, we're going to become healthcare professionals in the future, we thought it'd be interesting to talk about it on our podcast. So if we start off with what they actually are. So, Adil, what is your idea of stem cells? Because obviously you do biology. What do you think stem cells are?
So I would say stem cells, obviously the standard definition is, unspecialized cells that have the potential to differentiate into, specialized cells and tissues. Yeah. So I think what I learned as a casual, basic knowledge on this topic, I would say stem cells are something where, it's very initial stages at the moment. That's what I have. That's my understanding. In treatment.
Okay,
yeah.
in treatment.
I think I think I can speak for a lot of people there.
Yeah.
So for me, it's kind of one of those ones where it's like those kind of concept medicine type treatments, and it's something where in the future maybe it can be effective. Yeah. But right now it's just more in the initial stages of just trying it out.
So. I agree that's what it is, but this treatment is actually, like you said, it is sort of groundbreaking. So first of all, what mesenchymal stem cells are, they are adult stem cells. So we've learned that in biology, adult stem cells, so they can only differentiate depending on where they're found. So like if you have stem cells in your bone, that can only differentiate into like bone marrow and cartilage and bone, and if you have like in your gut and stuff, or they only differentiate into the tissue types that they can actually differentiate into.
Yeah.
So the mesenchymal stem cells that are used in treatment, so Dr. Neil Reardon, he actually has something called the Stem Cell Institute where he does treat patients, and it's in Panama.
Okay.
So
so is that where he's based?
Yeah, that's where he's based. So he's got another clinic in America, but American regulations, I don't think it allows him to use them in the same way.
Okay,
so there's still different types of stem cell treatments, but the one that I actually learned from is the one of the one that he has in Panama. So basically, what it is they use allogenic. I think that's how you pronounce it. What they do is they don't. Usually what mesenchymal stem cell treatment is they take out stem cells from your body.
From the patient's body. Okay,
and then inject it back into where it needs to go.
All right, yeah.
But what the mesenchymal stem cells that they use in this treatment is they take it from umbilical cords.
Okay, yeah.
So what that does is you instead of having your own stem cells, you get it injected into you from another source.
All right.
But they are still mesenchymal stem cells. Does that make sense?
Okay, yeah, that makes sense. Yeah,
makes sense.
So is there a particular reason why they do that?
Basically, there's depending on the potency.
Yeah.
The level of acceptance in the body changes. So if you take them from embryos, Dr. Neil Reardon talks about it in Joe Rogan's podcast. He says that they can actually lead to tumour because they reproduce so rapidly that it can lead to that. And also it's more ethical taking it this way, which we'll discuss later why it is so ethical. Like there's no argument against
real
it,
support for the stigma around it, really.
And also the body, when you give adult stem cells, you don't need to use stuff like immunosuppressants. So the body does accept it. There's no rejection.
Also, there's no rejection, so even though it's not the patient's own.
Exactly, yeah.
Okay,
so that's why. But obviously, they do have to culture it and stuff. They do need to make sure that it's properly monetized and properly monitored, and they need to make sure that it's free of all virus and bacteria when they do grow. And that's the only way that can be okay to put into someone's body. So the MSCs that are used, so far what we've covered is the MSCs that are used by this institute are from umbilical cords. So after a lady gives birth, after a woman gives birth, and then the afterbirth comes out, the placenta and the umbilical cord, they take them, and then they withdraw the stem cells from that, and depending on they can sort of monitor it to see if it is healthy or not to use.
So is this like any like general like birth in a hospital, like?
Yeah.
Just anyone's.
Yeah.
birth?
So normally they throw this stuff away, but
Yeah.
what they do is they take it
instead,
and then they see if it's healthy, they see if it's going to be useful, and then accordingly they grow it from that.
Yeah.
They grow the batches from that.
Yeah.
So that's where it's harvested from. The stem cells that are used by Stem Cell Institute in Panama, they take it from umbilical cords that otherwise will be thrown away.
Okay, so it's not the fact of whether, you know how some people might argue, oh, what if that would have developed into like a human being or something? It's not. It's not. None of that.
It's not embryonic.
It's not embryonic.
You don't like take it from, what is it called, the blastocyst?
Yeah, the blastocyst.
Yeah, you don't take it from that. So that leads us on to ethics. So we've covered where it's harvested from. So it's the umbilical cord, and that leads us on to ethics. So millions of millions. I don't know if it's million, but there's a lot of children being born every day.
Of course,
and what they usually do with these umbilical cords, they just throw them away.
Yeah.
But why would we not use them? Because if they have no use anyway, why can't we then use them as a source of medicine? So I personally don't understand how this could in any way be unethical. Do you have any arguments? Because
yeah, of course, I really don't. But I just want to ask: is there actually like a argument for it being unethical? Is there people saying it? Or?
I'm not too sure. But
you can imagine.
Going back to the start, you said that people did always see stem cells. Just the idea of using stem cells. So just any stem cells, using them, people just go, oh, but that's a bit too far. You know, we shouldn't do that. We shouldn't mess with the body. But it's almost like a very advanced form of medication. So I don't see in any way why this is unethical.
Yeah, I think it's just a stigma that is drilled into people's heads, you know, through like media and stuff.
Yeah.
Of like, you know, kind of the new area of research. A lot of people tend to focus on the negatives rather than the positives.
Exactly. Yeah.
Or like they kind of say, oh, you know, you're playing God and stuff like that. Kind of scared of.
But yeah, that's more stuff like gene therapy though.
Yeah.
Which I mean, that's a whole different.
That's a whole different story.
But the stem cells that are used, they're taken from umbilical cords that will otherwise literally get thrown into the bin.
Yeah, so there's really no argument.
So I don't see how this is bad. Yeah. The only real issue currently is that it costs so much.
Okay, the actual procedure of making...
The procedures of making and culturing the stem cells, the mesenchymal stem cells, cost too much. But the reason for that is because it's not widely available. It's only exclusive. So it's seen as, like, because it's exclusive, it's seen as only sort of rich people can go ahead and get this treatment.
And that's with a lot of things. Like initially, you know, when something, a new concept, new medicine, new anything comes out, it's always going to be expensive in the beginning, and it's always going to be kind of like specific, exclusive to privileged.
Exactly. But I will just say, when I was watching a video of Mel Gibson, and this is actually on their website, Dr. Neil Reardon was talking about who his patients actually were, and he was saying that in America, so in the UK we don't have to pay for procedures like that, but in America they do. Well, he said that he did anyway. I'm not too sure, and he said that for a hip replacement, he had a hip replacement, and he had to pay like $29,000.
Crazy amount of money.
And he was there for 4 hours, but the treatments that he said that there is only one form of treatment that they do that is more expensive than that. So in America, for example, if you are a person who can afford these surgeries and operations, then you can also then afford the stem cell treatments. But again, the argument is, if it was widely available and there was more research into it and more
knowledge, public knowledge on it,
more knowledge on it, then people would be more encouraged to provide it at a lower price. And that is what he says. Dr. Neil Reardon, he says the only reason why we currently are making it so expensive is because that's how much it costs for us. But if everyone was doing it, then eventually it would get lowered, because all this information, there would be more trained professionals, there would be more accessible facilities and stuff. So it would be more widely available, but making it cheaper.
So is it something that the government knows about, or like official organizations know about, or is it like an independent thing?
What, the Stem Cell Institute?
This whole treatment.
I know that this treatment isn't available in America, I don't think. Okay. So it's only available in Panama, and that's because they allow it. Yeah. So I think there are some forms of stem cell treatment in America, but I don't think it's widely available or as accessible as it is in this version of Panama. Yeah. The only thing that Dr. Neil Reardon does say is that he says Japan have introduced... They've basically allowed companies to research.
Okay, yeah. So they know about it. The government in Japan, they've acknowledge this.
Yeah, because the stem cells potency we are aware of, but we haven't applied them into medicine fully yet. But
yeah, we've
Japan
just scratched the surface, really.
Exactly.
Yeah.
But Japan have said to some companies, they've said, look, you can research into stem cells, and if you prove that it is effective and it is there is no way of like contaminating them and affecting anyone's health is adversely, negatively, then what you can do, then you have 6 years to provide that it is ethical.
And do you have like a timeline for this? When was this? When did this begin? Do you know?
I think like maybe 4 or 5 years ago, he says, but yeah, it's in the podcast.
Yeah,
I'm paraphrasing, but
we'll send the link to the podcast in the description.
The only other place that I'm aware of, and he talks about, that is actually doing major research into stem cells is Japan.
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 I mean, it's always the Japanese anyway. So.
Yeah, exactly. So, but yeah, they do research into this kind of stuff, so that's why it's allowed. So we've talked about ethics, where they've harvested from, but now we need to actually know what these mesenchymal stem cells do in the body. Yeah. So basically, like we said, we already have these foundation blocks that we refer to as stem cells, and these form the rest of our body as we get older. So if we injected stem cells into us, it wouldn't make that much of a difference, because our stem cells are still replicating and regenerating at quite a steady pace and quite a fast pace.
Okay, yeah.
But as people get older, the amount of time that it takes to replicate, so instead of 1 day, it will take 2 days, for example. Yeah. And that means that it will take a lot longer for someone to produce, like, let's say 2,000 cells at the age of 50 than it will be for us to at the age of 19.
19, yeah.
Do you get what I mean?
Yeah, I get what you mean, yeah.
So, the stem cell treatment is, there is some forms of, like, when it's used for autism and stuff, but if it's like heart failure or just like joint pains or arthritis, which you see in like older people, that stem cells are more effective. And the reason for that is when you do inject these stem cells, usually it's done intravenously, which means injection. When they do that, what it does is it promotes, one second, so it produces molecules such as cytokines and growth factors, which promote regeneration. So that means when you inject these new day 0 cells into your body, what they do is they promote all of your other cells to then start doing what they used to do and reproduce more effectively. Okay, yeah. So what they do is when you inject these into your body, they almost make your cells younger. Those stem cells that already exist and the cells that already exist in your body. All right. They reduce inflammation and they modulate the immune system as well. So the most important thing is when you inject these into your body, they promote regeneration. Right. Yeah. So that's the main aim. That's the main thing. There's also a lot of advantages of like decreasing inflammation and stuff and modulating the immune system. But the main thing is they produce growth factors which allow the cells in your body to almost become younger and regenerate faster. So, going back to the point, say if I broke my leg now, I'm going to be able to heal that leg faster than someone who is like 80 years old. Yeah, just naturally you'll be able to heal it faster. And the reason for that is I've genuinely got this mechanism that I have to do that kind of stuff and replace and heal let's say the broken bone. Yeah. The stem cells that I have, because they regenerate faster, I can do that at a faster rate. Which means that if you inject these into someone, these mesenchymal stem cells, then the effects are literally unforeseen. I'll give you an example. Mel Gibson talks about his dad. He had loads of problems, like problem with his lungs, problems with his kidneys, problems with his hip, and he goes, if I was to go take him to the hospital, he would not have recovered from any of the operations that they would. Any of the conventional procedures, yeah. So he was introduced to mesenchymal stem cells, this Mel Gibson, and then he took his dad to Panama. And it literally, he said that now he literally walks like he's about 60, 70. His eyesight improves. Eyesight improves. And that wasn't something they No. That was like a side kind of bonus, really. Exactly, yeah. So they just injected him with these stem cells, and all of the existing problems that he had literally disappeared. And he had like 5 or 6 main like problems that are like you cannot treat. Like you cannot, after a certain point, you can only prevent the symptoms for them.
Yeah.
But he...
Do you know any of them, or did he not elaborate on that?
I can't remember the exact list, but like it was a problem with his kidneys, problem with his lungs. I think he had heart failure, but all of them afterwards. He basically is now 99. He had this injected into him when he was like 92, but now he's like completely fine. There's nothing wrong with him.
Crazy.
And occasionally he'll go back and get more stem cells because they don't last long. So I guess that's a disadvantage.
A cheeky top up.
Yeah, I guess that's a disadvantage. But yeah, so when he does actually get this injection into him, he stops feeling any of the symptoms that he used to previously.
So is there no side effects that he's reported, or is there...
No, that's another thing. We'll talk about it when we compare it to current practice. But literally, there is no side effects that he experienced.
Because genuinely, if you weren't Eri, if you were some bum that I met on the street and you told me this, I'll be like, no way.
This is miraculous.
This is a con.
Yeah.
This is a scam. I'm telling you, this is a scam. Because this is crazy. This is straight out of sci-fi movies. Honestly, I mean, that's just how crazy
it
is.
Another example is a guy went to Dr. Neil Reardon after he had a spinal cord injury.
Yeah.
So he couldn't use any of his legs.
Uh-huh.
Either his legs. I said any of his legs. Like we've got
octopus.
But yeah, he couldn't use waist down.
Yeah.
And then they injected him with stem cells, and he began to walk. So like, every time they injected more stem cells into him, he got more function. And afterwards, after the whole treatment, he began to walk again. And he, before and after the spinal cord injury, you couldn't tell a difference between his bodily performance.
Yeah.
And these are actually all examples. I will just say these are all examples, and there are like case studies and stuff. And this is what I'm basing my judgment off, because there are actual people who have reported
actual case studies. Yeah.
Like autism, for example. I'll just read it out. I think it's to do with like when you insert these stem cells, they allow more oxygen to get to the brain or something. So address the causes of oxygen deprivation. So it overcomes that in autism. So children who are autistic, or anyone who's autistic, if they get stem cells into their veins, then that can also improve their situation. And the report here is that a kid, after being treated with stem cells, who had autism, he began to talk.
He began to talk. So before
previously he used to just like echo and like make sounds, but then afterwards he began to speak actual words. So it says here, after being injected with stem cells, previously he couldn't, like I said, he couldn't formulate actual words. He used to just like make sounds. But afterwards, maybe like within a couple of days, I'm not too sure, but it says that the kid literally said, "I want pizza." So he actually spoke.
Well, he's got his priorities right. I can say that. Flipping hell.
But yeah, so other treatments include multiple sclerosis, autoimmune diseases, rheumatoid arthritis, heart failure, like we've mentioned. There's so many things that it treats, which honestly, it does sound like
too good to be
too
true.
Miraculous.
Too good to be true, yeah.
But yeah, that's what it is so far. There is, with autoimmune diseases, so what it allows is, because we talked about it earlier as well, because these are adult stem cells, the body doesn't recognize them as foreign. Mm-hmm. Even though the source isn't ourselves, it still doesn't recognize it as foreign, which means that when we do inject it, there's no rejection.
No rejection, yeah.
And because there is no rejection, there's no side effect.
Okay.
Do you get what I mean?
Yeah.
So even that makes it a positive, because there's nothing that you feel that would think, oh, I don't want to do this.
That is safe. You're reassured it's safe.
It's safe. And like when you treat, for example, say when you get like a kidney transplant, you need to use immunosuppressants and stuff. You don't need to use any immunosuppressants, so you can just take these and your body will not reject them. Therefore, you can inject them as much as you want, really.
So is it? Well, I was going to ask that actually. Is there like a limit? Or is I'm sure there is.
There must be.
There must be.
There must be. Yeah.
I mean, there must be like certain doctors. How do they? I don't know if you know this, but how do they like figure out how much you need, or did they just like do it bit by bit? And
I think most treatments are like a week. or like 2 weeks. But I think the dosage depends on, first of all, how much you're willing to pay, because depending on how much you do pay, you get more. And also it depends on the treatment. So like, I imagine you will require less if it's like a spinal cord injury, because there's not that many. I mean, I might be wrong here, but like, if you're like trying to regenerate like a muscle, then that's going to require more than your spinal cord, which is it's quite fine, isn't it? You don't want to overdo it with the amount of stem cells, because the spinal cord doesn't actually have that much oxygen delivery to it, so you wouldn't want to inject too much into your spinal cord and stuff like that. So there must be a limit, but I'm not too sure.
So like, this is really like really stretching it here, but can it be, you know, like literally what you see in sci-fi movies where people like regrow limbs and stuff? Is that the same as this, or is that a bit too?
I don't actually
a bit
think.
Too out there.
I think it is too, but I don't actually think these cells like differentiate and to the point where they can grow whole limbs. What they do is they promote growth of what is already in our body.
Okay, I understand.
So I mean, I'm not too sure, because that is what Dr. Neil Reardon says. He says that what they do is they promote growth. They don't like they when you like inject it, because let's say type 1 diabetes, when your pancreas, your beta cells they're not functioning properly.
Not producing insulin,
they can solve that issue, but I don't know whether they form like new tissue or if they allow the repair of old ones. I know when you have heart failure and you get injected with stem cells, what it then does is it allows the current tissue to repair itself.
Okay.
Do you get what I mean?
Yeah.
So what they do most of all, and the most important thing they do, is they promote growth and regeneration of what's already in our body.
Okay.
And that's why it is so effective, because it's not like we're replacing stuff in our body. And that's another ethical side to it, a positive side to it, because when you inject it into your body, it's the stuff that already exists
in your body,
that allows you to then go on and heal yourself. So, and the reason for that is it's literally just the cells that at day zero, and you're going to be able to, they're going to be able to regenerate faster than most stem cells in your body, and produce these molecules that our body requires, these signaler molecules that promote growth and regeneration, because they encourage that to the existing cells in our body. That's why it is so useful, because when we inject them, they do everything that our body did when we were first born.
Okay.
Or the stem cells in our body did when we were first born. Do you get what I mean?
Yeah.
So I guess we've integrated advantages into all of the stuff that we've mentioned so far. So like, if we compare it to current medical practice, we already compared the side effects to it. So there are actually no known reports of side effects. But I will say, most case studies are like, I don't think there's any older than 10 years. So we don't know how much it's going to affect people.
We don't know the long-term effects, really.
So the long-term effects, there's not a lot of reports on, because it is quite new. But compared to current practice, so what are the disadvantages of current practice, in your opinion?
Of course, the big one is the rejection of, because a lot of the times we do inject like foreign objects into our body, like a kidney transplant or something like that, and then obviously the body will have some sort of rejection to that. Maybe it will, maybe it won't, but obviously that's a big risk. So that's one. And you already mentioned how that's lacking in here. That's not the case here, basically.
Yeah.
So that's one. Another one, I guess, is, well, you can say like conventional like drugs and stuff. I mean, drugs in general, they're just known for having a host of side effects.
Yep.
And here, I'm still trying to process it myself, really. But here you're saying there's no reported side effects.
There's no side effects. No.
And that's just crazy.
I guess like on a small scale there might be, because I don't want to rule it out completely and be incorrect. But so far, what I've seen from here, there's no reported side effects.
And that itself is just crazy. I don't even think I need to say any other advantages or this. No.
What it is like you inject this into, and any tissue that is lacking in your body, it starts regenerating again, so it becomes younger and more healthy. And what the problem we have with current medicines, as two people who study pharmacy, we know, is that you can't tailor medicine.
Yeah.
So when you go to the GP in England, what they do is they probably give anyone with a similar situation the same dosage, same age. So if you're the same age, same gender, same height, same weight, you're probably going to get a similar dosage. And if not, there's a broad scale, and people are going to get similar dosages for this one problem. But that doesn't tailor it to you, because we all have different functions. We all produce different amounts of molecules. Course, we have different ways in which our enzymes work.
Because at the end of the day, it's just every single human being. It's not like we're meant to have the same bodily functions. We all do have different bodily functions, and that's just natural.
Exactly.
It's just us as people. We've kind of just categorized different illnesses, saying, okay, this is that illness, this is that illness. But at the end of the day, it's really individual to each person. Whatever, one illness can affect two different people completely differently.
Exactly.
But because we can only name it between what we observe, we might name them as two different diseases, but really they're the same disease or something.
Exactly.
Like that.
Or the drugs that we use to treat the symptoms of or the actual problem, then that might affect people completely differently.
Yeah, exactly.
So that's why we have alternative drugs. If one person doesn't get better after taking one drug, we increase the dosage, or we give them a different drug which is more dangerous and has more side effects. And that's what I'm saying. What we do is almost like trial and error, and that can lead to people getting wrong medications or the wrong dosages, and that can make it worse for them in the long term. So that they go to the GP, they get prescribed a drug, and they go, okay, you have to take this for this much time. And if it's a drug which they have to take 4 or 5 times a day, then that can be really bad, because you're putting so much into your body, so much chemicals into your body, so many chemicals. And if that is prescribed at a wrong dosage, that might make it completely wrong. That might make it completely worse for you.
Yeah.
Right?
Yeah. I mean, it is, at the end of the day, when you think about it, drugs is such a big gamble.
It is. It really is. It's a gamble.
When you do think about it, it's just, the whole thing is just a whole one big gamble, because at the end of the day, you really don't know how it will affect that individual person.
Exactly.
It's just based on past case studies.
There's no individuality when it comes to drugs, unless it's at hospitals, what they do in wards and stuff, the pharmacist's role is to view the PMR, the patient medication record of the patients in the ward, and prescribe or change dosages, not prescribe, but give recommendations on dosages and the drug itself, depending on
based on
current drugs that they're on or drugs that they've had in the past. But that doesn't happen when say you have an illness, you have a cold or something, you go to the GP, or you have a pain somewhere, they just prescribe you a drug, and the pharmacist over the counter and the GP, they don't really take into account everything that you've had previously. Which means that the current medicine system is very much not tailored to individuals and what individuals are. And the easiest way to overcome that problem is by this, surely, because these stem cells, they can become what you want them to become, which is you. So when you insert them into your body, they just allow what you have to be more efficient.
Yeah.
Instead of drugs. So I'm pretty certain there's loads of drugs for that you can use if you have diabetes, not diabetes, heart failure, arthritis. There's a lot of ways of treating autism, spinal cord injury, all this kind of stuff. There's a lot of treatments out there which can be operations and surgeries, or related to medicine. So you could just take something that would supposedly want to make you better. But if we can develop all of these problems, if we can get rid of all of these problems by taking these day zero cells, which will allow our current bodily function to become more efficient, then that overcomes all the problems of drugs. So what are the problems? Like you mentioned, side effects, not tailored to individuals, and it's also quite important, and not a lot of people are able to monitor effectively how they're taking drugs. So some drugs are required to take at the same time every day.
Yeah.
Some people can't do that. Some people can't take 4 drugs in one day. Some people can't take, as you get older, people walk around with bags which they have lots of drugs in.
Pills and pills, yeah.
And that's obviously going to be bad for you, because you're dependent on those. So to me, that's why stem cells are good, because you don't need to do all this kind of stuff and experience all these kind of side effects. All you have to do is just get this injection, and that overcomes the problems that you would face if you were to take medicine. So what we said was that these stem cells, they allow the cells in your body to become what they were when they were younger, so regenerate faster. And to be fair, that's the only time that I do see a problem with stem cell treatment, because a lot of problems a lot of failures we get with our body as we grow older are related to old age, and
yeah.
related to the dysfunction of stem cells and just cells in general in our body. So what that can do is that will massively. So I'm thinking, if we are able to constantly inject ourselves with stem cells, theoretically that should make our life expectancy drastically more. Like, unless we, I guess, like cut off a limb, or not like cut off a limb, like
something sudden.
Something sudden, like there's a lot of different ways. Like if you were to, like, I don't know how to say it without
but I get what you're saying. Like all those
personal or offensive.
All those kind of like chronic diseases, or like those diseases where you're given you're diagnosed, and then you might feel like, okay, the doctor might say, okay, this is the amount of years you have to live. Stuff like that. Obviously not like sudden effects on your body or anything like that, but if diseases that are diagnosed and then can be treated with this stem cell treatment, we're basically trying to say that theoretically that means those diseases are literally just wiped out.
Yeah. So like a lot of people, as they grow older, they get like arthritis, they get osteoporosis,
and that often leads to further.
So like a lot of old people, they like almost struggle to walk after a certain age, as like they aren't as fit anymore. Their cardiovascular system isn't as efficient, their respiratory system isn't as efficient, and that's actually what mesenchymal stem cell treatment does. It improves everything. Like, it almost improves anything that is lacking.
Yeah, because the thing with old age is, the reason why you pick up so many illnesses, like they're flipping Pokemon or something, is because, you know, when you're older, your body is way less efficient at what it was when it was younger, and because of that, that's why you're more susceptible.
To
getting all these
infections,
cold,
to like the diseases that you mentioned.
So what these stem cells do is they kind of like renew. It's like a graph. Like this is a graph of your efficiency, and then when you grow older, it goes down. What the stem cells are doing, they're extending that graph.
Yeah, exactly.
They're renewing that.
Or they're like allowing the dip to like turn into a peak again.
Yeah, or even that,
Yeah. So like, that's exactly what it is. So that could then lead to people living until they're like 150, like 200, because it is a perfect way of like renewing. And that's, I guess, when the disadvantages would come in, because surely there must be an effect. Surely there is something that we don't know about these stem cells that will cause us to not be ourselves over the long term.
Yeah, exactly. Yeah, there's the whole scenario of, you know, at what point are you still you or something?
Like there are too many negatives, like too many positives. Sorry, so it can't improve everything. Surely there must be something that they're bad at, and that's why we need to do more research into it. Because if it is perfect, then why would we not do it?
But again, that's just gonna happen anyway. We're just gonna have to play the waiting game, really, because as you said, it's a very young treatment still. Would you say like oldest case is like 10 years or something?
I think so.
Something like that.
I think so.
But either way, even if it was longer than that, it's still like, in the broad scheme of things, that's still like really new. And the long-term effects, I think.
But we know so much about stem cells, and we have so much technology that we can do research into it, right? Why would we not? And see, that's where I think the money problem comes in. So when, like, I have a feeling I know where you're going. I don't really want to say it, but basically, when someone has a disease at the age of like 60, if they're going to live until they're 80, for 20 years, they're going to be on repeat prescriptions until they unfortunately eventually do pass away, which means that for that 20 years it's like a loyal customer. There's repeat purchase.
Guess who's going to be the loyal customer.
So they're just going to keep on requiring drugs and requiring medicine, right? So why would like drug companies, I guess, or people making money from medicines want stem cells if they solve the problem at the roots? So essentially what we're doing is, if there is a disease that you develop that cannot be treated, like type 1 diabetes, when you're is it type 1 or type 2? It is type 1, right? Type 1 is the autoimmune.
Yeah. Type 1 is
so type 1 is when you can treat that by giving medicine all the time, so like you get injections, the insulin injections. If you can treat that, so once you get type 1 diabetes, you can't then.
That's it. You're set for life.
That's it.
You're literally set for life.
So when you have type 1 diabetes, you always have to have these injections. So why would anyone want to solve that problem at the root with stem cells
if they're benefiting from you getting those injections?
If they're making more money from you making it from
and it comes back to you hear those conspiracies about how the cure for cancer is already solved, and the only reason they're not releasing it is because they're making money treating it. And I don't know, I don't really have an opinion on it, to be honest. It could be, it couldn't be. The world is mad as it is anyways.
Yeah.
But it does go back to that, and it goes back to how drugs and drug industry is just money making at the end of the day.
Yeah,
especially in countries like America and stuff. Treating illnesses and treating diseases is a money-making business at the end.
That is true. And also, that's something that almost angers me more, because, like, to market a drug, it's billions, right? It is so much money to make sure you go through everything perfectly. Therefore, we do have the money. We do have the money to research treatments, but I guess it's more profit if you do research into stuff that people
will spend more money.
Will spend more money on
in
the long term. And also, again, it's the problem of life expectancy. If we're all living till we're like 150, then we're massively going to overpopulate the earth.
That just brings a whole other.
So I guess that's where the problem comes in as well. But currently, I don't see any reason why these stem cells are not used, I guess, over medicine. I guess I don't know about stuff like cancer therapy or
the big boy stuff.
There's a lot of obviously there must be a lot of diseases and situations in which you cannot use MSCs, but there is also a lot in which you can and use them more effectively than medicines.
Current medicine,
yeah. So when I was first listening to this, and I'm sure anyone actually listening to this now is thinking, surely, like I'm talking shit.
Absolute bullshit.
I'm waffling, and I don't have a clue what I'm talking about. But I will just say, so the people that I know who have actually done it. So I listened to Joe Rogan a lot. He said he had a shoulder problem.
So he's done it himself.
He had a shoulder problem. He got stem cells shot into his shoulder, and it was fine. Like, he didn't feel it. And then a few years later, he had to do it again, but then he's fine now. And Dan Bilzerian always does it. I know he does it, and he says that he just feels fucking good about it. That's the way he describes.
So do they have to go to Panama every time they want to do this?
I don't know. There might be other stem cell institutes. I don't know, but this is the one that I know.
Yeah.
And I know that this is the one I think Joe Rogan goes to. So Mel Gibson also said the same. He had some problems. He got injected. Obviously, his dad that we talked about. So there are a lot of people who say that when you do insert these into your body, they genuinely just make you younger. And also, this is another fun thing. And evidence of this was, I think I might have told you this before, but what they done was they got an old rat and a young rat, and they sewed them together and sewed their circulatory systems together.
Yeah.
And what they found over time was that because the older rat was connected to the younger rat, and they had exchange of like fluids and stuff, what that done was that made the older rat younger. So it, like, not like literally, he's not like being born at a later age, like later stage. He's just like, his body is becoming more efficient,
behaving as it was when he was younger.
Exactly. And the reason for that is that the young rat, what that is doing is it's producing all of the molecules that we need for regeneration. And what that does is once that gets into the older rat's bloodstream, it promotes that to get younger. Do you get what I mean?
But does it affect the younger rat as well?
I'm not too sure. if it's like, say if one is
like a limited supply.
Say if like one is 20, one is 50. I don't know if they like
balance out,
even out. I don't know about that.
Okay, yeah. But that is really interesting.
Yeah.
I mean, it's crazy, but it's really interesting.
That is, it's a crazy thing to do, but I mean, it does show that the most important reason the stem cells work, the mesenchymal stem cells work, is because they promote almost being younger. They promote regeneration, and that's made evident in the example of the rats. When you do have these growth factors and these cytokines, what they do is they promote you to become younger. And I think that is absolutely mad.
It's crazy.
And I think, like, I can say it now. Obviously, overpopulation of the earth is going to be a massive problem eventually. But if I was getting older, and when I do get older, hopefully, when I am aware of this treatment and I can't access it, I'm gonna be angry because I'm gonna have to be almost dependent on drugs for the rest of my life, and that is what happens to people. They do become dependent on drugs. They do become dependent on their GP all the time. It's almost like a reverse of the cycle, isn't it? So you know how
when you're born,
you have to depend on people.
Yeah.
And then you have that gap where you're independent, and then you go back to
the baby state.
Yes. A lot of old people, for example, their eyesight that is affected with old age, which means they can't do stuff like drive because they can't see properly.
Yeah.
Which means that they're going to have to be dependent on people to take them from
A to B and stuff.
A to B, yeah. So if we do use these stem cells, that will improve, and that's just one example. And that's why I'm just thinking, like, there's so many advantages.
Not only does it increase quantity of life, it increases quality as well.
It definitely increases quality.
Yeah.
So yeah, and that's another advantage. The medicines that we have, that just increases the duration which we live.
Life, not the quality.
Not the quality.
Not all the time, at least. Yeah.
Exactly. But these stem cells, what they allow is, after a certain age, when most people become dependent on drugs, they almost allow you to start going on. It's funny, actually. I will just say, Mel Gibson's dad, apparently, he had an increase in his sexual drive after the age of 90.
There you go. Sign me up, mate. Sign me up.
After taking these stem cells. So you do
literally everything.
Yeah, it literally improves everything. How mad is this? Surely there must be like some theory behind this that deems it negative.
Yeah, because of course we're just talking it through our, what we know and stuff. Obviously, we don't have the full picture.
Yeah,
I don't think anyone does. Yeah, either. It's crazy. I mean,
I to be fair, if I was like a person who was to do research into stem cells, then I would obviously see more negatives of it if there was.
Yeah.
But from what I know, from like a pharmacist and maybe patient point of view, I know that so far I can't see why this is negative. If there are negatives, surely the positives outweigh the negatives.
Yeah.
But with older age, I think the most important thing is, so obviously we can use it now if we have a problem, say with autoimmune diseases and stuff, if people our age do. But with older age, it increases the quality of your life. And I mean, I don't know about you, but I have grandparents.
Yeah.
And I know that if they could be treated in this way, then I know that they will become stronger. Like, they sometimes struggle to walk and stuff, and they're not as strong, and their limbs aren't strong. If they fall over, they might break their arm and break their elbow.
They're essentially a baby again, like we mentioned before. They're essentially...
It's cynical to put it that way, isn't it? Like,
I mean...
it might, people might feel insulted if we say that you become a baby.
I get what you mean, but I mean, like, at the end of the day, you're not going to be how you were when you were 20s and 30s and stuff.
No, definitely not. And I think it starts at the age of, like, it starts quite early in people, because some people definitely start getting these diseases when they're in their like mid 40s, 50s.
Yeah, that's another thing. That's another aspect of individuality, where how some people will age faster than others.
Exactly.
So, for some people, they might need this treatment earlier.
That does all depend on our proteins, doesn't it? Depending on how well we function to produce these molecules, to allow us to regenerate and stuff. Because even at this age, like, sometimes, if I, like, for example, you see it in footballers, some of them, when they get, like, let's say a sprained ankle, they recover in like a week, and then some of them recover in like 3 months.
Yeah, you see it in football players.
I doubt anyone's waiting 3 months to recover from a sprained ankle. But I'm just giving an example. That there's a lot of ways in which we experience pain and experience.
We all respond differently.
We all do, and we all respond differently to the current medication we use as well. So from our point of view, how do you think it will change if mesenchymal stem cells were to be commonplace? How do you think that would affect us as potential healthcare professionals?
Well, it changes everything, really.
It does.
It changes everything, because I think, okay, maybe not in our like pan of graduating and stuff, but definitely like future pharmacists. You might find the whole pharmacy or medicine or any healthcare professional where they focus on the treating aspect. Their whole focus has changed from, in our case, maybe not drugs, but then now to these stem cells. Or, now to how to develop new stem cells, because obviously as more research is gone on, you're bound to find some problems, and then you're going to have to overcome those problems as well. And so I feel like it's just a shift in power, really, in it, from drugs to stem cells. I think in the future, who knows, you might find that our whole role as a pharmacist has changed.
I think, but as pharmacists, what we promote is just, we're not actually selling the drugs to make profit, are we? What we are there for is to advise patients, unless you obviously own a pharmacy, but what we are there for is to advise patients on a certain form of treating them, which is medication.
Which is normally drugs, yeah.
Yeah, which is normally drugs. So if this is introduced as a treatment, like, I don't know, the utopia would be this place where you can like go to pharmacists and in their fridges they've got like a shot of stem cells which you can just drink and then you ingest that. But I think our role would be in the future to just advise people on drugs, right? That is what we are going to have to do. And, say to patients, this is the best way you should take it, this is the most effective way. And if stem cells are introduced, then that would be the same thing that we would have to do. Just, look, this is what will happen when you take these stem cells. Yeah. This is how you should take it. So, in that sense, I don't think it will
change it. Yeah, the actual foundation of what we do won't change. It's just the focus in the area.
Yeah, because I guess stem cells would have a mode of action in the body as much as
drugs do.
Yeah. And I think it won't exactly change what doctors have to do either that much. If anything, it will mean that there will be less people who are having to like go through surgeries because of heart failure or kidney problems or autoimmune disease and stuff like that. So if anything, it's almost decreasing the workload,
which is another big aspect of, especially in this country.
Yeah, exactly.
The amount of stuff that healthcare professionals do and the lack of staff and all that. You always hear it in the news and stuff.
And having to take care of patients is a massive problem as well, like after they have had surgery, because, like, for example, in the case of Mel Gibson's dad, we said that he had a hip problem, and then afterwards he was able to walk. Or the guy who had spinal cord injury, he wasn't able to walk, but then afterwards he was, after he had stem cells. So what that means is you don't need carers who have to look after people all the time, or you don't need people who are dependent on other people, because, say if you have a hip replacement, you have to be, like, laying down for a long time for it to heal properly, because even when you do have a hip replacement, it's not like over and done with after the treatment, whereas with stem cells there isn't this long period of time where you have to of recovery.
I mean, that does make sense. But then on the flip side, someone might say, okay, so if people don't need carers anymore, then that's another like sector of jobs lost. Do you know what I'm saying? Like, you might find that's
true, but everything is to do with like net profit loss, isn't it? So in that sense, how many people will be employed to work in stem cell therapy stem cell organisations? So I don't know. I don't know what will weigh out.
Of course, it's just a ripple effect, isn't it? Because then you might have the fact of, okay, some people might saying, oh, for the economy it might be bad because there will be less jobs and stuff. But then at the same time, because of the increase in life duration, in increase in health, you find older people can work for longer at an older age.
Yeah, exactly. So, I mean, I'm not an expert on stuff like that, so I wouldn't be able to discuss.
Yeah, this is just like, really out there now. Just like,
yeah, so I'm not too sure, but in that sense, I think when we are investing so much money into medicines, we could at least invest some of that into researching why we should use stem cells, because. Like, I mean, in biology, at GCSE and A-level, we always learned that stem cells were literally these miraculous Lego blocks that you could build into anything that you want. Like, you have a whole bag of Lego and you can build that into however you want, right? But depending on, like, I guess some of that Lego you could have gone and stolen off someone. Some of them could have been bought for you. Like, do you get what I mean? So it depends on the ethics of it. But we've always learned that stem cells have been unethical.
Yeah, there's always a stigma around it.
Yeah, and I think this is what made me realise that, because I always thought stem cells from embryos, that's not like, you're taking it away from embryos. As something that can grow into something, you're taking it away. But umbilical cords, they just go to the waste. So like, you're not doing anything. Therefore,
You're
there's
just
no
recycling
effort.
them. Really, I don't know.
That is recycling.
Instead of chucking it away, you're recycling.
That is recycling, isn't it?
That's what you're
Oh
doing.
shit! I never thought about that. That is literally recycling stem cells. That's incredible. But yeah, I genuinely don't see why we shouldn't use stem cells. These form of stem cells. Anyway.
Obviously, we don't. As I said before, I just want to stress. Obviously, we don't have the full picture and stuff. So, someone here who has a lot of knowledge, they might just be sitting here watching us, being these idiots.
Yeah.
They don't know what they're talking about. But the whole point of this podcast is just to introduce you guys to the topic as well, as much as it was introduced to me recently by Ira and then him by the podcast. Because I think at the end of the day, there's not a lot of general knowledge on this topic. Or
what mesenchymal stem cells?
Or like, you know, if you ask people, like how you asked me, I knew nothing about this. I thought, okay, it's a concept, but I didn't know there was case studies. I didn't know there was
I didn't know
people that actually experienced it. So I think, yeah,
it was brought to my attention probably like a month ago now, and after actually reading on it, I thought this is genuinely not like the theories that we've seen before of like how we can clone stuff. This is actually evidence. There is evidence, practical evidence that this works. So we've done research into it, we've questioned it, and we've found out it works. There's not a lot of negatives to it. Therefore, why would we not implement it in our day-to-day healthcare professional lives in the future? That's what I'm thinking, because I think it's quite unfair on the current people who can't benefit from stuff like this because it is expensive.
Yeah, and but my question is, and I think a lot of people's question is, after hearing all this, why do you think it's so, like, it just, right now, it just feels like it's like some sort of exclusive club kind of thing, where only VIPs know about it? Why is it not promoted to the public? Why do you think?
That's a difficult question, to be fair. In my opinion, this is the case.
Yeah.
Well, first of all,
does it relate back to the point we made before about how?
Yeah, so I personally think drug companies do not want to do this because they make more money from selling drugs over a long period of time.
It's just easier to make money from
exactly.
that, yeah.
And that means that not a lot of companies are going into research stem cells because
there's no demand.
It fixes the problems at the roots. And when you fix problems at the roots, that's it. Like, you don't need to treat it constantly. And for that reason, it's seen as only VIPs can access it because, first of all, it is quite a lot of money. Like, for us anyway, because in England healthcare is free, but in places where healthcare isn't free, then you might think it is actually worth it if I pay this extra like $5,000-$6,000, whatever it is, to go and get treatment. But I think the main reason why it is exclusive is actually because there's not a lot of it. It's not widespread. We don't have a lot of places that do it. So it's almost like a few companies or like one company has a monopoly. And that leads them, that allows them to fluctuate the prices however they want to.
Yeah, it's all in their hands.
So when there is more competition, then they're going to be left with no choice but to lower the prices.
Do they have like a patent on it or anything like that? Like, do you know?
No, I don't think he does. I think the guy who I was listening to, so Dr. Neil Riordan, he says like the only reason why it is so expensive is because there's not a lot of people doing it. Even he says, he's like, once everyone is aware of it, once everyone sort of wants this and there's more demand for it and people have to supply it, that's
then naturally the prices will go down.
Naturally the prices will go down. I mean, it might go up, I don't know, but in my opinion, if a lot of people do start providing this kind of treatment, then the prices will go down and that will make it more accessible to you and I.
Yeah. So yeah, that's stem cells in a nutshell, really.
Mesenchymal stem cells.
Mesenchymal stem cells, yes, to be exact. And at the end of the day, I think me and Ira have the same opinion of why not. I think we just summarised it.
Why not?
In those two words, why not? Because really, it's completely crazy. It's completely mind-blowing. And it's just something where it's such a great opportunity, such a golden opportunity, I think, that we have the resources and the intelligence as society in general to delve into this and to kind of really investigate the true potential. Because I feel like we've only just scratched the surface.
Yeah, I think so too.
We've really only scratched the surface, and there's just so much more potential for it.
So much more we can develop, and so much more we can learn, and so much more we can treat from it.
So much more, and I think the main reason why we made this podcast, as I mentioned earlier, is just to introduce it to everyone else and to other people as well, because it's just honestly really interesting. I really do find it.
Yeah, I think it's just raising awareness. I think when I saw this podcast of Joe Rogan, I was like, this is mind blowing. Like, why did we not know about this?
Why did we not know
because
about this?
it can be so accessible. We should for some reason know about something that is just, I mean, it literally is just miraculous. The effect it has on your body is miraculous. Like, that's why it's so difficult to believe in it, because you think, surely it can't be this perfect.
It can't be, yeah.
And that's why we need more people to know about it in order to question.
Yeah. Because the more minds you have, the more people that know about it, the more people that will look into it, and the more likely you are to find the imperfections in it. But that's just part of it, isn't it? That's just part of the process, finding the imperfections and then at that time overcoming them. And yeah, it's just so much room for growth.
Yeah, I think
so much room.
I think this is the point where maybe as Philosophia we should actually discuss the philosophy behind it as well. So there were lots of methods of treating diseases prior to like what we have now, what we've established now, and it could have been like spiritual, ritualistic. I mean, we learned it in like GCSE history. I don't know if you've done it, but we learned it in GCSE history. We learned about all of these like different methods that people developed. But now it seems like we're past that stage of questioning, and we think, let's develop more medicines. Well, instead of that, why aren't we developing? So it's the Socratic method, isn't it? So we have to question always what we have, otherwise we can't develop it.
Instead of just blindly
instead of like keep why are we plateauing again? Why can't we start going on the high? Why can't we go rising again? So I guess that's what we need to look at. We need to start questioning why people need to experience side effects when they take drugs. Why can they not get better?
Yeah, instead of just accepting it as the truth of, like, you know, that's just life.
Yeah. Oh, this is a medicine. You'll come out better of it, but that's why you need to take it. You might experience, you know, like a lot of antidepressants, for example. They have lots of side effects. A lot of like other medicines, they cause you to have like suicidal thoughts. Like, if we have drugs that lead you to have suicidal thoughts, why are we not researching into
alternatives?
Do you get what I mean? So that's why we need to question. We need to carry on questioning this method of practice we have.
And it's just that general thing. I don't know if you feel it, but I feel it. You know, when you read history books and stuff, and you read how, or you know, when we're looking at lecture slides, and they say how, oh, at this time they knew this, they didn't know this.
Yeah.
And now it just kind of brings the perception of, okay, so now at this current age, it feels like, oh, we know everything. Well, we really don't. We really don't. But that's kind of I don't know about you, but to me, it's kind of perceived as like, oh, we know everything now. Oh, look at these silly people 100 years ago. They didn't know that. Now we know everything. But 100 years later, those people in the future might be saying to us, oh, look at these silly people. They didn't know anything.
And this is the start. They can only say that to us if we develop new medicine, new ways of treating patients. And I think this is the start. I think stem cells could definitely revolutionize the way in which we treat patients. I think that's quite important.
Yeah.
But yeah, have we missed anything? Do you reckon there's anything else we need to add? Because there is a lot. There's so much science behind it. There is so much theory behind it as well, and there's so much evidence behind it.
And saying that, I think we could just leave it off as just recommending you guys to look into it yourselves.
Yeah, more, yeah.
And I'm reminding myself as well, because I think I would really want to, like, obviously research into it, and perhaps, who knows, maybe in the future we'll get like an update kind of video on what we know now versus what we knew then. So yeah, I think that's just.
I think that's about it. I think the main point is just. We need to recognise this. I think that's the most important thing.
Just acknowledge the fact that it exists, and it is here and now, not something like a concept in the future.
You know, like there's like laboratory experiments that we learned of, like how they, like the Dolly the sheep, for example. That weren't actually them trying to clone a functional sheep, was it? It was just to see if they could do it. Yeah. But now this is something that is actually being practiced. Functional. It's not just experiments, it's actually functional. That it's gone past the lab stage now. It's actually in practice. And that's why we need to learn more about it, because if it is actually working, which we've proven it does, then we need to make sure that we can adopt this into our, I want to say society, let's say society, into the way that we treat people. And if we can, then it will revolutionize everying.
Yeah. I agree. I agree completely with you. And yeah, on that note, I think we can end it here. Thank you guys for watching.
Yep.
I'm sure you guys have a lot of questions, as I do now.
Yeah.
Again, after speaking about it again, and I really, like I said before, we really do recommend you guys just looking into it yourselves and letting us know if you know anything about it. If you find out later anything about it, just let us know. Leave a comment down below. Do you agree with the whole concept? Do you disagree? Do you kind of contest the ethics behind it? And yeah, I think we just really appreciate you guys spending your time listening.
Yep. This week's topic was science related, so we hope you enjoyed.
Yeah, we're kind of trying this thing with every upload. We're kind of trying to focus on a different area. So just to kind of like keep it as a variety. So yeah, thank you guys so much.
Thank you so much for watching,
and
guys.
take care.
It's been a pleasure. Thank you.